Welcome to MassageWise, everyone. I know I've been gone for a while, but today's going to be really simple. So before we get started, if you like this content and you want to see more, you can head on over to the MassageWise channel, and I have got a lot of content that you can go through and like and comment and subscribe and hit that bell for notifications. So we're going to get right on into it. So what are we talking about today? We are talking about a very important rule in massage therapy, the 72-hour rule. Now, this 72-hour rule pertains to inflammation. Now, why 72 hours, you ask? Typically, it takes 72 hours for inflammation to build up and then on its own recede. Now, inflammation typically is the body trying to defend itself. Unless you have a condition like mine, where I have Hashimoto's, inflammation happens whether you're injured or not. But in the case of the 72-hour rule, let's say we're going to do a really easy example. The example from a high-risk group. So elderly. Let's say you have a client come in that is about 60 plus years old. This is in the age bracket where their vitamin D deficiencies sometimes really add to a very, very bad thing with brittle bones. Let's say you have a client that comes in, they come in on time, but you either witnessed or they told you that they had a fall right before they came in. Well, anybody that knows this person is in a high-risk group and potentially could have broken or fractured a bone, they're not going to want to work on this particular client because they don't know if they're going to be further injuring them. Sometimes you can be injured and not feel pain, and a lot of people don't realize that is a real thing. So the 72-hour rule states that, okay, they fell before they came in. So 72 hours after the fall, if they come back, typically you can work on them. If you really aren't sure, you need to have them get like a doctor's permission note. So this would be like the doctor saying, we've ran tests, there's no fractures, there's no broken bones, there's no sprains, bruised muscular structures, etc. So 72 hours is the beginning stage of inflammation, middle stage, and ending. And I'm not going to bore you with the proper names of these particular stages because most people don't talk about inflammation. But we do know that there's the buildup, there's the midpoint, and then there's going down for any person that doesn't have a deep understanding of like Latin and whatnot. So what you do is if you've fallen, let's say you're in the parking lot, instead of going in for your appointment, you can go in and say, I need to reschedule. I've had a fall, especially if you are in a high-risk group where you are really elderly or you're in a group where your body isn't average level where you can take a fall and not have any really big issues. Most spas will let you get away with this quite easily, especially if you're in a high-risk group. No spa wants to get sued because it'd be like, oh no, we can let you come in. And then you find out later that you've had a fracture that the massage therapist, who was more than likely talked into working on you, exacerbated due to pressure, especially since a lot of the clientele that we run into love the deep pressure. They call it deep tissue, but it's deep pressure. We love you, but it's deep pressure. It's not deep tissue. So first and foremost, ice. You're going to want to put ice on an injury. If you had just had a fall, first, hour or two, ice it. If it's on a leg or whatnot, ice it and elevate it. And really take care of your body for 72 hours because you really want to make sure that you're helping your body in its healing process. If you just swelled up for a day or so and then it goes down and you have full range, there's no pain response, there's no soreness, no black and blue marks, you should be good for a massage. Now, there is only one particular type of massage that I can tell you that kind of goes against this rule, and that's sports massage. But this is a massage that is designed for athletes where you're using massage techniques to limit the damage buildup. So you're trying to utilize a manipulation of the soft tissues, so that's muscles, that's tendons, it's adipose tissue, also known as fat, and you're trying to make sure that you are allowing the body to have blood flow, that you're feeling for very gently a few things, like if there's potentially like a movement in the bone area. You're really trying to do a lot of good with sports massage. Now, not every massage therapist is a sports massage therapist. And just because they work on athletes does not make them a sports massage therapist. So really look into the certification levels of the massage therapist that you're working with for that day. If you've had a fall and they're a sports massage therapist and they're willing to work on you, that's on them. Typically, a lot of us don't like to, especially with high-risk clients, do that. However, if you run into one of those, that's the only group that may really have no issue with breaking the 72-hour rule. Thanks for enjoying this video. If you want to see more, head over to MassageWise channel where we have more content.